Dr. Fitzgerald, her study was excellent. It was based in Ireland, so they already have a national registrar on axial spondyloarthropathy patients, and approximately 60 to 65% of the Ireland population are also considered obese. So finding their studies supporting that obesity was a comorbidity for negative outcomes in axial spondyloarthropathy, regardless of medications that they were taking, whether they were DMARDs or biologics. Dr. Alivanani, and now he spoke on obesity affecting the synovial membrane of the tissues, and that's addressing the bench part, supporting our thoughts on obesity affecting negatively on rheumatoid arthritis, and starting treatment on obesity early on, regardless of when you identify the disease. What was highlighted with his study was actually that he found in clinical remission patients, whether it was image or with clinical function, the biopsies of the synovial membranes were still showing synovitis, which was highly important. Dr. Nicker-Faru, she talked about obesity, targeting the goals and function of rheumatoid arthritis, and she had a registrar based in UK, 2 of them, and they also had difficulties with obesity addressing treatment target goals for rheumatoid arthritis. So they found obesity as a separate risk factor for rheumatoid arthritis, as well as a comorbidity, increasing the rest of the target treatment for rheumatoid arthritis patients, as well as remission, achievement, and function. So she felt that obesity was also had common links with the inflammatory pathway in rheumatoid arthritis and shouldn't be ignored and should be addressed as soon as possible. So for an overview of all 3 of the titled abstracts, we found that obesity is internationally a comorbidity by itself. It is an independent risk factor for negative outcomes in autoimmune diseases, specifically rheumatoid arthritis, as well as axial spondyloarthropathy. So it highlights the importance of addressing obesity control and treatment early in the disease as soon as possible. Providers need to take the responsibility to make it an important part of the treatment program for our patients with axial spondyloarthropathies as well as rheumatoid arthritis.
Is there any information on whether obesity control or weight control does actually improve outcomes?
So with Dr. Fitzgerald, she had commented that there was no good studies at this point to see if there would be a difference with weight loss. However, with Dr. Alivanani and Dr. Nicker-Faru, they felt that the function for patients in rheumatoid arthritis were better achieved, and treatment targets were better achieved if there was less weight.
So is it possible that there are differences in terms of the disease type?
Perhaps. They had all stated more needs to be done with prospective studies to actually outline that correlation. You know what, it just outlines the fact that obesity is an international issue, not just a US issue, and it's something that all of us need to address, even as uncomfortable as it is to discuss that with our patients.